Alright, so Pharmacist Interventions Part 19. So I had a prescription sent over for a hospice patient. It was morphine 20 milligrams per 5 mils, and the dose was 1.3 mils every 4 hours as needed for shortness of breath. So morphine is used for air hunger and pain and end-of-life care. It was for a patient that was in her 90s. So the dose for this prescription I thought was too low. If you calculate it, it's about 5.2 milligrams of morphine. Which, if you're familiar with like hydrocodone, is almost about like 5 milligrams of hydro. Hydro is a little more potent than morphine, so that's not a lot. So I thought that they sent it in the prescription wrong, and it was supposed to be the 100 per 5 concentration, which is like a pretty concentrated version of morphine. So if it were actually the 100 per 5, it would have been 26 milligrams if we were going with that 1.3 mils. So I talked to one of the hospice nurses, and they're like, no, it's supposed to be the 20 milligrams per 5 mils. That's correct. It's supposed to be 5.2 milligrams. And like, I was like on the phone, like, are you sure? Like, I was explaining the difference between the 20 milligram per 5 mils and the 100 milligram per 5 mils. And she was like adamant, like, yep, that's what we meant to send over. So I okayed the order. So come like 2 or 3 weeks later, the prescription came through like for the 3rd or 4th time in our pharmacy, and then one of the night pharmacists caught it too, and then also called on it, and then spoke to someone else, and then they said that that was a medication error. So it was actually supposed to be with the 100 milligram per 5 mil. So the patient was receiving a 5 times lower dose than they should have gotten. And then I looked at the history of the prescription. It was sent in by 3 different physicians, one being like an end-of-life care specialist or hospice specialist. So that was one like medication error that I thought of that should have been fixed when I caught it the first time. But this patient was receiving the wrong dose like 4 times, which is not good. I noticed that the patient was also like early filling it too. So that was also like a red flag of this dose is probably not correct.